To the coronavirus as it spreads both here in the United States and abroad.
Let's start with today's big headlines on the matter. Continued fears over the virus sent the stock market back into a tailspin after yesterday's massive gains. We'll have more on that in a few minutes. Health officials in Washington state now confirm 9 people have died from the virus there. That comes as CNBC is reporting both Ford and FCA have banned all non-essential air travel, both abroad but also domestically.
Let's bring in Dr. Frank McGeorge. He's here now. Doc, it's important to be clear that the risk here in the United States still remains low despite these new cases.
Absolutely true, Kim and Devin. Overall, yes, the risk is still low, but we do expect to see more cases of community spread. And as more people are tested, the case count will rise. Now, today, our nation's top health experts told senators they are trying to communicate that sense of urgency, but not alarm.
As concerns widen, there's news a treatment could possibly be ready in a matter of months.
Within a period of a few months, several months, whether or not this particular drug works. If it does, the implementation of that would be almost immediate.
A vaccine, however, at least a year out, say national health experts who toured the National Institutes of Health alongside President Donald Trump. In New York, a second case now signaling the virus may be spreading in the community. A Westchester man who hadn't traveled internationally or come into contact with a known patient.
I said you'll start to see community spread cases where you can't track it back directly to one place or one visit.
The school one of the man's children attended is closed, along with at least one other. A Department of Homeland Security office in Seattle is also closed for at least 2 weeks after an employee fell ill after visiting a family member at the nursing facility where multiple people have died.
The employee did not report to work when they felt ill. We are taking these steps, again, out of an abundance of caution.
The message to the public, preparation, not panic.
In a large population, most people who get infected will probably have very mild symptoms. Some will have severe illness, pneumonia, and be critically ill. And what's unknown right now is what that full total will be. You know, will we have many more cases a year than we have with flu, which would be very difficult to handle, or will we be able to slow the spread and protect the healthcare system?
Now, there was also testimony at the hearing that India is now restricting the export of 26 pharmaceutical ingredients and the drugs made from them because they have concerns about shortages in India. The FDA is investigating that list to see how it could impact the supply chain here in the United States.
You can see a hoarding mentality breaking out in a lot of different avenues if it gets
right.
to that.
And every country has to protect their own supply chain as well as their own drug manufacturing, but obviously we are all a global community.